Okay. Hello, everybody. Good afternoon. Thank you so much for joining us. I'm so sorry. We are a few minutes late starting this afternoon, but we'll get started now that everybody is filtering in. I can see lots of people joining, which is great. I'm just going to let a couple more people filter in before we get started properly. But whether you're joining us in the morning, in the afternoon, or the evening, thank you so much for doing so. It's really nice to see so many of you online, and I'm very much looking forward to our session this afternoon. So I think that's just about everybody. So we will get started. Welcome to our session this afternoon. My name is Kate Richards-Whitworth, and I work in the recruitment team for the Masters in Global Healthcare Leadership. Today we're going to be hearing from a panel that's made up of some of our brilliant alumni community. They'll be talking more about their experiences on the programme, but also the challenges of leading within and healthcare environments and healthcare organisations around the world. We are recording today's session, so for anybody who would like to revisit it, or indeed for anybody watching on catch up who wasn't able to join us live, and that's also part of the reason that we've recorded the session. For those of you who are joining us live, the chat function is up and running, so please feel free to post questions, and we will do our best to answer those as part of our conversation. At the end of the session, I'll also briefly run through the application process for anybody looking to submit an application for the programme this year. So our next intake for the Masters in Global Healthcare Leadership will start in September. But to get the session started, I will just kick off with some key facts about the programme itself. So the Masters in Global Healthcare Leadership is a relatively new programme. It launched for the first time in 2022. So there are 4 cohorts that have been admitted to the programme so far. It's a joint programme, so the Masters is run in partnership between the Saïd Business School and the Nuffield Department of Primary Healthcare Sciences. It's actually the first time that the University of Oxford has run an accredited Masters programme in that context. So it's a really exciting and programme to be part of, and a really nice example, I think, of the interdisciplinary environment that makes up the University of Oxford and the benefits that exist within that. The business school obviously brings to the programme experience significant experience in areas like leadership, innovation and entrepreneurship, while the Nuffield department brings a huge amount of experience and knowledge in areas like primary care, digital healthcare and health behaviours. In terms of the structure, it's a 2-year part-time programme, which is broken down into 18 months of teaching and then 6 months working on a final dissertation. There are 8 modules in total, and it's a programme that is designed for people who are working full-time. So the aim is that participants are able to gain the qualification without either stopping work or having to move to Oxford. We have 1 intake every year, and as I have just said previously, the next intake is in September of this year. The fees for that programme are just over £65,000. Just digging into a little bit more detail around the programme itself. So you can see here the module sort of names and also the module dates for the programme that will start in September. Module 8, which is our online module, doesn't actually start at the beginning of the programme or kind of either the beginning or the end. It runs concurrently across the second year of the programme. So as well as the in-person modules and the dissertation work that take place in that second year. You are also completing the online module in study design and research methods. And that module is split up into 5 online blocks of learning. The in-person modules are spaced about 8 to 12 weeks apart. So you're in Oxford every couple of months. And the rest of the time you study from home. So that time is focused on pre-work, on and the pre-reading and the reading lists before each module, the assessments, and of course the online module blocks, as we've just talked through a little bit there as well. In terms of the study commitment outside of the classroom, it's about 10 hours of study time per week. Some weeks can feel a little bit sort of busier. Some weeks and maybe a little sort of more opportunity for flex. But in terms of taking on the programme, that's the level of study commitment that we advise that people kind of make sure that that they can commit to. Thinking about a typical class profile, we see classes of about 30 with an average age of about 41, and we see candidates coming into the classroom with on average about 15 years of work experience. So that's broadly comparable with other executive accredited programs at the business school. We see about 35% female students each year, and a really nice and diverse classroom, both from a nationality perspective and in terms of the number of industries that are represented. So it's we really like to have sort of as high a level of diversity in all things as we possibly can. It's obviously particularly important for discussing or for working through a program that has a focus on the global. So thinking about that and that kind of sense of global scale and global scope, but also thinking about the number of different sectors and subsectors that we see represented. So even kind of within what would be the broader healthcare sort of industry, we see a good mix of physicians and non-clinicians. We see practicing clinicians, we see non-practicing clinicians, but we also then see people working in lots of sort of different areas within healthcare. So consulting, finance, healthcare technology, pharmacy, and we see people working on the governance and government side of things as well. And there's a very nice entrepreneurial thread that that runs through the program as well, which is also really nice to see. So thinking then a little bit about our classes, I'm going to introduce our panelists. Fatima, unfortunately, has not been able to join us this afternoon, but we're very lucky to have Haswan and Coyote here with us. Haswan joined the very first and inaugural cohort of the master's programme, and Coyote was a member of cohort 2. So they have both been through the whole of the programme journey from that moment of kind of first interest right through to, I think, graduation for both of you, and that experience as well. So what we'll do for the rest of the session is we'll have a kind of a Q&A, a bit of a conversation between the three of us. For anybody who has joined the session, as I say, if you have any questions for our panelists, please drop them into the chat and we will we'll feed those in as appropriate. So I'm going to stop sharing my screen now, just so that we get a better look at everybody as part of the conversation. And for Haswan and Coyote, it would be great if you could start off just with a brief introduction on kind of who you are, where you're based, and what you're doing at the moment. So Haswan, if you're happy to kick off, that would be great.
All right, thank you, Kate. Great to be here. Great to speak to you and the rest of the prospective quad 5, I suppose. It's gonna be the 5th one, right?
That's right.
Yeah. My name is Haswan. I am based in Kuala Lumpur, Malaysia. I'm currently the CEO of Protect Health Corporation. It is an agency under the government that does the national strategic purchasing for health services. And this is my new role. So I've been in this role for in the last 6 months or so. So before I joined the MGHL, I was in consulting and I was also in the digital health company. right? So I guess that combined with some of the things that we learned in MGHL that took me to this current role, right? And yeah, I was part of MGHL cohort one, and happy to share a bit more about the journey that I've gone through. Thank you.
Fantastic. Thank you so much. Coyote, over to you.
Yeah, thanks, Kate. Thanks, Aswin. And pleasure to meet everyone on the call. Name is Kayode Fasom. I'm a medical doctor. Currently, I'm based in Nigeria, specifically Abuja, where I lead our current consulting practice, Volt. We're based in Abuja, but we work across Africa on various um, aspects of healthcare. But we think about healthcare as a point of call. There's a lot of work we do beyond health as well. And our focus areas or geographical areas of focus, like I mentioned earlier, it's across Africa. So working with different government to advance some of the health priorities that ensures that healthcare outcomes reach the population that need them the most. I think the program has been very beneficial in various aspects. I think we'll get into the details. I've gotten a lot more than I literally bargained for, but I'm happy to share a bit of those experiences. But a pleasure to meet everyone, and looking forward to the ensuing discussions over the next couple of minutes.
Fantastic. And thank you, Coyote. And really interesting to hear already a little bit about how the program itself has already had a bit of an impact on your professional journeys. My opening question to you both is around that question of global healthcare leadership. What does that look like in the context of the work that you're doing at the moment? I came to Haswan first for the introductions, so I'll go back to Coyote to come in first on that second question, if that's okay.
Sure. Thanks, Kate. It's a very interesting question. Given one, the portfolio that I lead from Nigeria, working across Africa, but you often understand that health as a commodity, or thinking about health as a commodity, has a lot of factors that influence it at the global level, at the regional level, but country level. And in countries, you have various subnational priorities impacting health all at the same time. If you think about that in itself, that's already a lot of challenges or perspective or dimensions that you see healthcare playing in. One I can easily make reference to is the current geopolitical crisis in the Middle East. It's got direct implications for healthcare, especially if countries are relying and even continue to rely on logistics and supplies for essential commodities. That is already causing a lot of a lot of issues with commodity availability that is impacting healthcare. One critical example is we are seeing the direct effect on prices of fuel per liter. What that does in countries with very limited insurance coverage, where there's a lot of out-of-pocket expenditure, is that there's a lot more money going to some of those resources just to keep a life going. And you've got to keep juggling resources as an individual, but even at government level, to define what you can provide for the population that you are leading. So the context around global healthcare, even yes, we're talking about health, it's often enshrined in a lot more adjacent, or even more distant challenges that directly impact it. And that's one area that we can make a point as an example. What we have been able to go through on the program across different modules, and I think you showed a bit of that earlier, is that these will continuously happen. I think one of the constructs that the reason behind this program initially was the challenge with healthcare leadership during COVID. It looks like a long time ago now, but we're seeing that while COVID has gone, we've got a geopolitical crisis now. There's all the issues around COVID are still there. On top of that, there are additional challenges that healthcare continues to face. So it's really an impactful program, but in terms of what healthcare is facing, the challenges are numerous. It's being faced with innovation in AI, etc., etc. So we can go to town, but I think this just lays out uh, uh, the environment, that is very challenging. And as leaders, we have to juggle through all these various challenges to make sure that healthcare is delivered to people that need them the most, irrespective of where they are across the world.
Absolutely. And Haswan, what would your perspective and be there in terms of global healthcare leadership?
Okay. Thanks, Kate. Perhaps I'll give you a bit more flavor of my day-to-day and my current initiatives. Right now, I mean, medical inflation has been one of the hot topic in the last 2 years in Malaysia, and the government is, for the first time, is trying to curb this, stabilize the medical inflation, and getting the whole of country to work together. So I'm talking about Minister of Health, Minister of Finance, all the 40 insurers and all the 200 private hospitals in the whole country to work on this what we call a reset program. So one of the core mechanism is to move away from fee for service, which then we are working on outcome or DRG, disease-related group-based payment. And my agency is the one that is currently implementing this. And that requires aligning insurers, private hospitals, clinicians, and governments all at the same time. So every day involves navigating that sort of that complexity. We also get involved in the policy design with the Ministry of Health and the Ministry of Finance, governance work, managing teams across financing, digital system, program delivery, as well as external engagement with the insurers, hospital groups, and various partners. And on top, and this is just one of the major programs that we're embarking on this year. And this is shift in the payment system is something that was not done before in the country. We are doing it based on a lot of technical support and theories, but now that no one in the country has ever done. I always joke, right? No one in the country has ever done this, so we are actually sort of in this together. And I think leadership is something that can make this happen. And then on top of that, we have other programs where we run programs for the lower income groups, health screening for lower income households in Malaysia. That the target beneficiary is about 7 million Malaysians. So there's a lot of work to reach out to them. Some of them are in remote places where there's no access to labs for screening, right? So we have to find a way to even get their blood samples to the nearest town or nearest labs. So those are some of the things that we are working on.
Fantastic, thank you. And as when you mentioned at the beginning of the session, it's a fairly new position for you, and that you've made that transition obviously since your completion of the master's program. How did your study? How has that sort of, if it did, but how did it help you to make that change? And kind of was it a driver in you making that transition within your professional life?
Okay. Yeah. Before I started my career as a strategy consultant, mainly in financial services, I got into healthcare by virtue of founded a digital health company. I worked with my partners, focusing on some of the new technology in healthcare, starting to learn about the healthcare industry without any medical or healthcare related background. And over the 5, 6, or 7 years I was doing that, I've always felt like an outsider to the healthcare industry, right? So you don't have, because you're not a doctor, you're not an MD, you're not I mean, you're nobody here. Here, there's very paternalistic, very old industry that everything is clinically and medically driven. So one of my objective to when I joined MJSHA was, okay, I'm gonna break that, right? So I'm gonna get this MSc, a degree, and no one can dispute what I'm saying. I mean, like discredit things just simply because I wasn't a medical doctor, I wasn't a clinician, I was not a healthcare person. Well, I mean, that program, just gave me a lot of confidence in terms of debating, arguing a lot of healthcare policy related, the latest issues in healthcare, as well as the network that you get. Mostly are in most cohort members are in leadership positions, so that gives you a lot of confidence in terms of getting into this role, this national role, right? I now have confidence that, okay, whatever it is that I need, whether it's something technical or something, like clinical, I have someone to access to, like, directly, and not just within the country, like, it's just literally everywhere in the world, right? I can literally reach out to Coyote and say, how do you, transport blood across from the blood bank to the rural part of Africa, and how can we do that here? I mean, things like that, right? So that gives you a lot of confidence. I can reach out to someone in America in terms of how not to screw up DRG-based payment system or something, right? So I think that's it, right? So I think after doing this 2 years, give you a lot of confidence and access to something that you didn't have before, and can really help you in sort of like, uh, getting into the next stage of your career.
Fantastic, thank you. Coyote, how about you? Has the MSc changed the way that you think about leadership, or what has been the impact on your professional life so far of having completed the program?
Yeah, thanks, Kate. And as one, I completely agree and align with some of the examples that you've provided. I think on this part of the world, there are several challenges and competing interests that are driven by policy or people or the existing system. Again, as I mentioned earlier, that creates a specific challenge to deliver outcomes. But I do recall one of the modules that I think one of my best modules actually, I think was module 3 on systems leadership. And in that module, there was a lot of reflection, but also introduction to very practical tools that enable one to specifically understand how best to navigate change, but even understand the problem from the construct. And this is layered on my background as a management consultant for many, many years, worked at global level with the UN, but also at regional level, but also extensively across countries on the continent. There's often the knee-jerky reaction to solve problems, which can be shiny and very focused on immediate wins and results. But the dirty and murky pathway to sustainable work that provides or that yields a long-term result, it's often grounded in more system type interventions, and that comes with different skill set that one has to develop. Yes, I had taken leadership, I had led roles at the global level, at different across different and with different partners before now. But how lens to view that approach provided with the my current transition or the work I'm currently leading right now in Nigeria. And I keep applying that to various constructs. One of the immediate ones was working with the federal government of Nigeria on advancing some of the health priorities. Was in the news a couple of months ago. And one of my deliverables working with that team at a very high level was thinking about what healthcare will look like 5 years down the line. And it was easy for me to get into my pocket and pick out one of the tools that we had looked at, again, in module 3, where you've got to try to, in the midst of all the uncertainty and the limited data that is available, you can still try to focus on a North Star. And working with the different stakeholders, we're able to figure that out. What is the desired goal, even though we know we don't have the necessary infrastructure to get to that right now, but we are all focused on what that deliverable is. And again, when you're working through multiple stakeholders, rather than the talk or the empathy or the social skills you have, you've got to be able to channel everyone to focus on a goal. And getting everyone to focus on that as a North Star enabled us to walk back, and do a reality check as to where we are right now. And with that, we're able to then build plans to advance the healthcare system from the current situation to where we want it to be over the next couple of years. So there's several aspects of the model or the course that has been very influential. As one has, one big example is also, reaching out within the cohort. For my cohort, we're 38 from 23 countries, literally from every part of the world. What that does with a trip of finger is getting access to anyone anywhere in the world. And so you can look at this within your cohort. So we were in cohort 2. Haswan is in cohort 1. There are folks that I speak with and exchange ideas within cohort 3. And the cohort is growing to cohort 5. So within that pool already, if you're pulling everyone together, you've got a global network of concentric skills and availability that you can tap into. A lot of folks have actually also transitioned from within the program to start doing PhDs, given the access and visibility and the clarity that they have in addressing global problems. So it's been a resource that keeps on giving. I've tapped into that a whole lot within the class, but also beyond that. In some of the other things that I'm doing in Nigeria with the business school to advance some of those initiatives and priorities on the continent. So it's I would say, like I said earlier in my introduction, it's one it keeps giving, and it seems limitless, being alumni of the program. Over.
Fantastic. Thank you so much, Coyote. It's great to hear you talking about not just the relationships that you've built up within your own cohorts, but as you say, between different cohorts as well, and kind of seeing and feeling the benefit of being part of that broader healthcare leadership community within sort of Oxford, but also now globally as well. Coyote, continuing a little bit with that thought about leadership and that kind of global healthcare context. Are there any capabilities or mindsets that you think are particularly critical for healthcare leaders today? How are those apparent in the work that you're doing?
Again, thanks, Kate. I think really, really great question. I think when people hear leadership, it can be scary. For various reasons, but you could also understand leadership from various constructs or things that we've heard and read before, and you can define it in different using different parameters. The authors have described various leadership styles, from the coercive type to the authoritative style and various aspects. Again, depending on who you read or the schools of thought you follow. I think one of the very early bits of reconfiguration that happened for me, and again, I think it's the beauty of how the program arranges the modules. I think from the first module, there's a clear understanding and push to understand who you are as a leader. I think importantly, one of the things I came out of during that module was, if you can't lead yourself, if you don't understand yourself and can't lead yourself, it's difficult to lead in complex situations that you will find yourself as a leader. So one of the great inputs from that module was, while it's important to understand that their leadership styles, because of the need to morph across different contexts, you've got to be flexible enough to move across the different types. That creates some level of resilience for you as a person, but also helps you to achieve your goals, because regardless of what you do, you are bound by certain deliverables, and how you get that going, it's a function of how you decide or choose to lead. So in terms of the skill set that are required, there's a whole lot of emphasis on redefining what your social skills are. You definitely, because you will be working with people. So you've got to find a way to ensure that that's an asset, and understanding who you are as a leader. Again, given making specific reference to the models, it's not just to point out the gaps in yourself, but it's understanding what the gaps are and be intentional about working towards fixing them. And the program walks with you through that journey to understand where you need to make changes happen. So there's a lot of self-awareness that needs to happen within that, where you're also able to self-regulate upwards, downwards, and stay coasting along, but also finding avenues to motivate yourself going forward. Again, there are different frameworks that helps you understand, the construct of organizations and how you lead through that, from the organizational culture. And the essays that I think we wrote were also beyond just being very, I guess I'm giving clues to people on the line right now, but it's designed in such a way that it forces you to bring those things to life. You really reflect on what you do as a leader, putting yourself in those situations or the scenarios and using them to drive. And those have become part of those have become skill set that I keep dipping into in various contexts that I find myself. So I would say it's been very, very, again, rewarding in so many ways. And in terms of the skills that I think might be useful, I think these are some of the ones that are readily that I can easily relate with right now. And I think I'm sure Haswan has a bit more as well, given his role at the national level.
Yes, thank you. Has one is because you have completed the program a few years ago now. I'll turn to you broadly with the same question, sort of around capabilities and mindsets in healthcare leaders,
Yeah.
but with an additional sort of little thought. Have you seen a shift in those capabilities or mindsets since you joined the program, and perhaps as you've moved from one position to another?
Mm. Thanks, Kate. I think there's two parts to this. As I said, I was the healthcare outsider coming into healthcare. So there are some parts of the program that built sort of healthcare led modules, right? The evidence-based, now that, if someone talks about, okay, is this based on any evidence? And then, okay, let's talk, how strong is your evidence, right? So we can have a meaningful debate and discussion with a lot of medical people in the medical fraternity as well. The second part is, I think this is the hardest. Is very what I figured recently, in combination of all the experience going through this program, is it's easy to do the it's not difficult to do the right thing, but it's very, very difficult to do the right thing right? So for instance, right? I mean, say you want to do something, that's evidence, and this is your priorities as a healthcare leader, right? But there are, the whole army of people in every parts of the industry, from insurers to providers, to workers, and that everyone has their own point of view. Everyone has their own vested interest. Everyone wants to protect their turf, right? So those are the very, very complicated part that I think we have to really be ready for. And I don't think that's enough amount of training to be prepared for this, right? Being able to engage in a meaningful, debate, able to understand the perspective of, every single, as every single parts of the industry, and then thirdly, jumping, then finally making that decision, a policy decision or policy implementation from your position that would help everyone. First of all, it's the patient, the people, the members, right? You talk about healthcare equity and all that, right? But at the same time, like not victimizing any parts of the healthcare ecosystem, right? So I think those are the trickiest and most complicated part. It's not hard to find the right evidence. It's not hard to find, the right thing to do, right? Yeah.
Okay,
Yeah.
fantastic. Thank you very much. And that maybe actually leads me on quite nicely to another question. Linked for me, I think, to doing the right thing and doing the right thing right. But can you think of a moment, um, Amazon, during which you've had to lead through uncertainty or particular complexity, and just sort of tell us a little bit about how your learnings on the program had an impact in that context?
Um, yeah, my favorite module is still the evidence-based module, right? And I think that and that gave me a realize, and I wasn't a researcher before, so I wasn't exposed to a lot of things that is done behind the scene in the research uh, and develop. I mean, in the research world. So that gave me a good taste of how to synthesize a lot of information, a lot of evidence around there, and to help guide you make the right decision, right? So I think that was one of my most valuable part of the program, yeah.
Fantastic. And Coyote, how about you? You talked a little bit in your introduction about leading through some levels of uncertainty and complexity at all times, really. But is that kind of an area of your work where you feel that the program has had any impact?
Yeah, absolutely. I mean, I think during my earlier response to your very insightful questions, I had created a scenario that revolve around the uncertainty and complexity that we live in, and the sort of more immediate to potentially long-term impact, or at time immediate to long-term impact that we are currently seeing or we will be battling with down the line. But more specifically, I think one major challenge at the moment, with uncertainty and complexity, is the delivery of healthcare in Africa, and to a very large extent in Nigeria, has often followed donor with support from donors. And we've seen how this has the recent pullout and the reprioritization from certain countries sort of affected health financing across this pool of countries. It's sudden, it's without a lot of clarity, and it's put a lot of decision makers in very difficult position to make very acute health-driven decisions affecting millions. One major impact of those funding pullouts is immediate stock out of commodities, HIV medications, TB, tuberculosis medications, malaria, etc., that folks across different geographies live with. As a matter of fact, in Nigeria, there are about 2 million persons who are on HIV medication that are provided for with support by a couple of donors. So you realize that the reprioritization of those funding to those programs has a significant challenge, has caused significant challenge for the survival of those programs. But even more is the care to those patients in terms of managing resistance, ensuring that you don't create new bubbles of outbreaks or or pandemics, as it were. So these are some examples of how uh, uh, countries or leaders across countries are jostling with this. And even though I work from the private sector, supporting our work with government, we also see this impact the kind of work and how we think about the work directly. But I will take us a little bit back to, again, one of the models. So specifically, I think module 2 that looks at work looks at organizational resilience. And in that, there's a whole lot of discourse around what skill set or what efforts are available to help leaders go through those transitions. I think one of the interesting discussions was around the tuna framework. So leading in times of turbulence, uncertainty, complexity, and when there's a lot of ambiguity, ambiguity in not enough data points, you have to make decisions. So as one had mentioned, things around looking for evidence and how do you use that based on the limited amount of quantity or quality of information that you have. Because regardless of the limitations, you as a leader still have to make decisions. For a couple of millions. Just for context, Nigeria is about 200 million, over 200 million people, and there are states that are bigger than countries. For example, Lagos, which is the financial capital, has a population of 20 million. That's 3 times the population of Denmark. You've got a very dense economic centric capital that you need to lead on with all these complexities. But I think I would say that, in my view, the program has capacitated me quite a bit with a lot of those tools that I keep going back to. Fun fact, we wrote 7 essays, about 8 essays. All of them at the time I was writing them look very futuristic. So I feel I was 2 years ahead of a lot of the discussions that are happening right now. And every time I reflect and I read those, I feel, okay, I think we have enough content, right, to contribute to to do a lot of work around thought leadership, develop a lot of policy briefs, which you get to. Yes, I've written policy briefs before, but you have a full, sort of toolkit or toolbox to always, go back to refine. Again, you always want to get better. And those tools are available to support some of the decisions and actions I have been leading on, that I would also encourage folks on the call to consider, and we continue to consider as we grow our cohort, but also grow in a different leadership capacity. So there's a whole lot that I think on a personal that I've been exposed to, that I find very useful to lead in the various contexts that I have myself. And I think it will continue to be useful going forward.
Fantastic. Cody, was there anything that surprised you about your experience on the program or since then?
In terms of surprise, I think it's the world of resource that one has access to. You would not know the full content or context of that until you walk into the on TBEC, Touch Business Education Center, or the Side Business School in itself. And I would say, again, from a personal point of view, that while I had my cohort, you often find yourself mixed with colleagues on the other executive programs. So venture capital course, you find folks in the executive MBA across different cohorts as well. I think there's other programs that the business school offers with people all under this about innovation that open up a whole lot of options for you. For one, again, depending on your interest, but you then see that there's a whole lot more that the program offers beyond your class. There's a whole lot of resources you can lean into, and that's within the business school. You've also got your colleges, and a lot of connections you can make within that and across other departments. I think, as Kate mentioned, this program is one of the few, probably the only one in Oxford at the moment, where you've got the Norfolk Primary Healthcare Sciences and the business school collaborating to deliver this program. So what that means is that you've got resources on both sides of very huge, well-endowed programs and schools, at department, as it were, where your reach and resource is endless. So like I said, it's one program that keeps giving, and happy to have gone through the program with what I have currently.
Fantastic. Thank you. Has there been anything about your experience, again, I'm kind of either going through the program or since, that has surprised you or been particularly transformative for you? Oh, you're just on mute at the moment, as well.
Okay. There is a lot of friction throughout the 8 modules, and a lot of debate, a lot of, and just like any leadership environment, right? Everyone's a leader, everyone has a strong opinion, right? Uh, and that friction was a scary place at the beginning, and that turns to be a very much a safe space, by halfway through module one, right? Because you're in this room with all the leaders and from various parts of the world, and that friction, I think, is the one that forms that forms a lot of insights, and let you getting deeper into what you're looking for. Um, so if just imagine, like, um getting into a debate with someone who's been doing in NHS, and while you're just trying to understand NHS for from one article, right? And I think that sort of accelerated your learning, but at the same time, simulated the real world. I mean the real world environment. Secondly, I think the most transformative effect would be the cohort effect itself. Right. So as a cohort, as I said, it tends to be a safe space, and you just get the most out of it. And the last thing, it really depends on where your starting point is. I think the Oxford effect, the environment itself, like drive you to want to do something bigger, drive you to want to do something more with all the resources available at hand, as Coyote described earlier. Having access to both schools, in fact, in the entire university, right? The only thing I regretted was not spending a lot more time there throughout the modules. Yeah. Thank you.
Okay, lovely. That actually takes me very nicely onto what will be our my last question for our panelists. So Haswan, I'll come straight back to you just so that we don't lose that thread. But what advice would you give to someone considering this program? I'm kind of somebody who is wanting to lead meaningful change in healthcare.
Okay. Um, yeah, I think I have very few very specific things on this. It really depends on where, as I said, it really depends on where your starting point is. If you are, looking to, get a bit more repetitive and jaded with the kind of things that you go through every day, and you want to just break into that, meeting new people, learning new things. Sometimes you may not learn new things, something that you already know, but I think you have to come to the program with the right mindset of, okay, I want to get the most out of it. Else, like, what's the point of spending, about 12 hours a day for every 2 months in Oxford, and talking to new people. So that's the right mindset. And I think second part is, in general, because many of us have been many of the cohort have been doing the in their role for maybe like 8, 10, 12, 15 years. Based on the average age and all that, right? Um, what I was told from talking to a few friends as well, like, if you feel like there's some sort of ceiling in where you are at, right? At your workplace, in your organization, right? And th this is probably a place to break that probably mental block, and figure out what you want to do next, right? So it gives you a nice exit from your current environment, and let you think about something bigger that you want to do, right? And I have to be honest. There are moments in the program that you feel, oh, come on. This is so something you feel, you're undermining the learning, right? Oh, I already know this. Do you have to go through this? Or if it just turned out one of those days that you'd the professors is not as excited as some others, right? So you feel like, oh, why am I wasting an hour here? But I think stepping out from that, I've always talked to some of the qual. Look, I mean, you're there, right? You definitely like have to get something out of it, even because many of us have not been back to school for many years, right? And this is the time that for you to get the most out of your modules and your learning, right? So I think those are the few things that I think should be expected, and you should know exactly what your objective is coming to doing this program, because you're going to spend a lot of time and resources for 2 years, and it may not come out as you planned, but at least you're clear on what you want to get out of it. Thank you.
Fantastic. Thank you, Haswan. And Coyote, how about you? What would your advice be to someone who's considering this program?
Great. So one thing I wanted to mention about what surprised me was about the intensity. It's very intense, guys. It's very intense. But in terms of what new prospective folks should think about, it's please know your why. Be very clear about your why. It will get refined at every point. For myself, I knew my why at the beginning, but it kept getting refined every model. So incorporate some level of flexibility and truthfulness to yourself. Once you attain your initial why, feel free to reappraise and set the bar higher. That way, I believe you're able to get more or derive more value from your experience over the period, over the 2-year period, especially given the resources and time you put in over.
Fantastic. Thank you both so much. Well, that just about brings us to the end of our time, which has worked out quite well. But I'll share my screen in a second just to talk through a little bit of information on application requirements for anybody who's planning to submit an application. But thank you so much to our panel and to Coyote and to Haswan for joining us this afternoon, and for sharing some of your perspectives on both your time on the master's program and your the work that you're doing at the moment. So thank you both very, very much. So as I say, I'm just going to share my screen again just quickly so that we can take a look here at the application requirements. So for anybody who is considering or planning to submit an application for the master's program this year, this may well be information that you already have and that you're already aware of, but just to run through to finish the session. You can still apply for the program if you would like to join us in September. We have 2 further application deadlines that will run until June. So you have time, as I say, to make a decision and to submit an application. In terms of requirements for admission to the master's program, we need you to have a 2-1 or higher undergraduate degree or equivalent international qualifications. You don't need to have studied medicine or to have worked as a healthcare professional. There is always a mix of clinicians and non-clinicians in the classroom. We do look for at least 5 years of relevant professional experience, and then it is really important that all candidates have working proficiency in the English language. In order to complete an application, we have an online application form that you work through in your own time and submit. So we'll need to see a copy of your CV. We'll need to see a copy of your transcripts of any higher education qualifications. So transcripts are the official record of the modules that you studied and the grades that you achieved. So they are provided by institutions as an additional piece of documentation to any certificate that you would also have received. We need to have at least 2 references, and of those, at least one of those needs to be a professional reference. And then there are 3 application essays as well. 2 of those essays are 500-word kind of a little bit closer to personal statements. And then there's one academic essay of 1,500 words as well. There is no GMAT or GRE requirement for this particular program. We do have a two-stage application process. So as well as completing the application and the application form, our candidates will be invited to a 30-minute online interview, which makes up the second stage of that interview. So that brings us to the end of our session for this afternoon. Thank you so much again for joining us, and I hope that you've enjoyed the conversation. And thank you very much again to our two panelists. For anybody who is already in touch with us, and please do stay in touch if you have any questions either about the programme, the application process. We are always very happy to hear from you. If you are coming to the programme for the first time, or if you're earlier in your kind of relationship with the programme, then and please do get in touch. My colleague Laura will be very happy to hear from you. You can download a brochure for the programme. You can submit a CV for us to take a look at and advise in terms of suitability for the programme. So contact details for Laura are listed here. I've just realised that I neglected. Oh no, I did. The next application deadline for the programme starting in September will be on the 11th of May. Please do get in touch, as I say, if you have any questions or if you would like to learn any more about the programme. But thank you so much again for joining us this afternoon, and enjoy the rest of your day. Thanks so much. Bye bye.